welcome. We still have seats available. And so I'm Stephanie Miller. I'm the Director of Special Gifts here at Animal Humane. And if you are here, it's because you support our veterinary clinic, either as a donor or as a volunteer, and many of you do both. So thank you. We're very happy to have you here. Part of my job is in fundraising is specifically to raise money for our veterinary clinic because it is so important to everything we do here. So I'm going to jump right in, and hopefully we'll have time for some question and answer. And then also when our panel is done, Samantha is going to give a tour, a behind-the-scenes tour of our clinic for anyone who would like that. So my first question for our panelists is if you could please introduce yourself and say a little bit about your background in veterinary medicine and what you do here at Animal Humane.
Hi everyone, I'm Samantha Montgomery. I'm the Director of Veterinary Operations here at Animal Humane, New Mexico. I am an RVT and have been in the field for about 12 years or so. My role involves a lot of different things, kind of from day to day. I help train technicians on the floor, help with the budgeting, and anything in between. I've been in this role since the middle of January. However, I've been associated with Animal Humane since about 2014.
Hi everyone, I'm Val Wilson. I'm the Executive Director for Animal Humane New Mexico. I have been a part of the organization since 2015, and I started as a front office lead in our veterinary clinic. So I was a lower tiered lead and worked my way up to clinic manager, and most recently was Director of Veterinary Operations prior to Samantha. And in December, the board voted me in as an executive director. I've been involved in veterinary medicine since I was in high school, so many, many moons ago. Was previously a technician before coming on board at Animal Humane.
Hello everybody, I am Dr. Adina Robertson. I am the Chief Veterinary Officer here at Animal Humane. I've actually been here only since December of 2022, so new, but I'm loving it. This is absolutely wonderful. I love the organization, I love the mission and our values. So I've been in veterinary medicine for over 25 years. I actually started off in kennels and worked my way up, doing technician work, assistant work, being a receptionist, and then went to vet school. And more recently, I actually sold my practice. I had a practice here in town, which I sold, and then came on board here.
Thank you. So my first question is kind of a big one. It'll probably take up some time, but I think it is also going to be very interesting. What do you think have been some of the biggest challenges for the clinic in the past year or more? And this will be interesting because you all, I think, have a slightly different perspective based on your jobs and your time here.
You want me to start?
Yeah. Yes.
Val.
So many of you may or may not, some of you may know this, but last year we experienced the loss of 3 of our full-time previous veterinarians. They had all been with the organization for over 8 years or longer. And as you know, every part of the care that we provide to the pets here at the shelter has a full impact coming from the veterinary side, whether that's at the start of intake with vaccines, heartworm prevention, all the way through behavior modification medication, through sterilizations, through isolation units, areas. All of those require a veterinarian. And last year was difficult. The volunteers that are here can probably speak more to that. Not only was it difficult for the staff, it was difficult for our volunteers, and that overall had a huge impact on the rest of the organization. And knowing that we did not have consistency amongst the veterinarians also made it very hard and difficult to bring pets into our care. So that was one problem that we experienced. I think that I'll end there and let everyone else chime in, or I'll keep going. And I want to share the love with the share the love.
One of the other challenges the last few years has been the shortage of veterinary staff, especially technicians and people who are already trained. And so we have had to really bolster our training program and kind of train people from the ground up, which, as you know, can slow things down just a little bit in the process. We are high volume spay neuter. We do have lots of pets in the shelter. So it adds a little bit of friction to a system that previously was pretty well oiled.
Oh, man.
Good
No,
luck.
I know, right? I'm like, oh, no, what they've already said, they've already just said so eloquently about what our issues are. And it really is. It's having to do with the veterinarian shortage, the veterinary staff shortage. And that's not just us, that's nationwide, that's everywhere. Everyone I talk to in other states, that's really where we're having such a problem. We just do not have enough veterinarians and veterinary staff and everyone just to help just meet the demand that's out there. The demand has increased so much, and we are just not able to meet that demand quite yet. The other issues that have actually come up in the last couple of years, honestly, is actually supply chain. We've actually had difficulty getting medications, supplies, even something as simple as gauze will go on back order, and that has to do with nationwide shortages in employees and being able to manufacture these goods. So that's also been a problem too. Just honestly getting supplies for us has been difficult.
Would you like to say more?
Something else that we have seen because there's been less access to veterinary care, not just here within our shelter, but across the entire state and locally in Albuquerque, is many pets are unable to get sterilized in a more timely manner or get their core vaccines in the time frame that they need to in order to be a healthy adults moving forward. And so as we're receiving younger pets, so foster age pets, many of these pets are coming in sicker, smaller compared to the size that they should be. So they're spending longer time in care, receiving treatment, whether that's in foster care or in our isolation units. So again, that's more resources, veterinary time, technician time, animal care time, foster care time that we're having to utilize for those particular pets. So as we move forward, looking to see how can we help eliminate that or decrease the time that they're having to spend not available for adoption.
Just one last thing to kind of add, over the time during the pandemic, veterinary services were so stifled that we're seeing many puppies and kittens from unwanted litters. People didn't have access to spay neuter, and so now the volume of pets that we're seeing is more than we can handle.
Thank you. So on the flip side, what have been some of the big successes in the vet clinic?
I would have to say our training program for sure. We have been able to train up a lot of really great technicians, so that's been kind of a point of success for us, for sure.
Well, I am most proud of hiring 2 veterinarians. Like Dr. Robertson mentioned, we are and continue to have a veterinarian shortage and support staff shortage across the country. And as our previous veterinarians left to move on to new exciting things for themselves, we were worried, how are we going to continue? The last thing we wanted was to have to stop the operations within the shelter especially. And a lot of that meant finding new partnerships and new connections within the community, which ended up coming about with finding Dr. Robertson and I actually worked together previously. Yep. And when she applied, it was a breath of fresh air of we're going to get through this, and it obviously has worked out very well for our organization. So being able to hire herself as well as Dr. Julie Blossom, who comes to us. Previously, she was in private practice, as well as the Albuquerque Biopark, and she has brought some very new, exciting things to the clinic as far as starting acupuncture for some chronic pain management with some of our shelter pets, as well as helping with their fear, anxiety, and stress in the shelter. And she really is on the rehabilitation side, which, as we know, a lot of that is in sheltering. So those are one of the things that I'm most proud of as far as where we've come from.
Thank you. So yeah, we've actually had a lot of successes. What's been great too is that we've been able to open back up our spay neuter to the public as far as that goes, which has been wonderful to see that. It's been so great. We've been able to reopen our TNR program, which has also been really wonderful. What's actually also kind of neat too is now that me and Dr. Blossom are here, we've been able to have a veterinary student come and extern with us. She's from Northwestern University, so we're able to host veterinary students and expose them to shelter medicine and expose them to what we do, which is a really good opportunity for them, but also for us. It really is. It gets our name out there. It very much so. It lets us, spread a word. It increases our reputation. It's wonderful. We're also able to host PIMA veterinary technician students, which has been great too, because they're actually a really good source for hiring. But also too, it allows them to get experience in shelter medicine, see what we're about, and go back to their instructors, to the other students, and tell them how amazing we are, which has been wonderful. So those have been some really good successes for us so far.
Val, maybe you could say a little bit about everything you did to recruit veterinarians, because I think people would be a little surprised because you did a lot. Maybe you could talk a little bit about that.
So, as you know, days in the clinic are very, very busy. And when we first found out that we were going to have to start recruiting, I would spend about 5 hours of my morning on my computer. I would call every veterinarian that I knew. I would text them. I had no shame in doing this whatsoever because I knew it was for the better of the organization. I was on LinkedIn pretty much 24/7. If you were a veterinarian within reach of any states around us, I was going to reach out and message you. And many of those didn't really go anywhere. But again, it was putting our name out there and putting our name into not just our community, but nationwide. I contacted pretty much every vendor that we work with, whether that's our vaccine vendor, vendors that I've never actually met in person. I was emailing and calling and saying, this is the situation we're in. We do not want to have to close our shelter. Please help us. Help us get our name out there. Another area that I worked was the veterinarians locally. We have a veterinary group, Los Sueños Veterinary Group here in town, and the practice owner of that organization, I connected with her after our New Mexico Humane conference, and she let us utilize her veterinarians, and that allowed us to never have to close our shelter. We had a rotation of her veterinarians every single day coming in, which also posed some interesting dilemmas. But again, we never had to stop the shelter operation, and the pets continued to get their care. They continued to get sterilized, and they had the ability to continue getting adopted. And it was really about making those connections, and again, having no shame that this is what the situation is, and we need your help. This is not just an us problem. This is a community problem. And if you can't support us as a community, to ask anyone and everyone that you may know, that if they know a veterinarian that is looking, a veterinarian that may be looking to move to our state, please help us. Because we, as you know, we don't just impact Albuquerque, we impact the entire state of New Mexico. And I took that to our clinic managers group. I reached out to other shelters in our states to see what they potentially were doing. So it was a good 9 months of that day in, day out. But now we have our 2 wonderful veterinarians, and hopefully more to come as the months move forward in this new year.
Thank you. So you've mentioned the challenges with the supply chain, and there was a time there where folks couldn't get spay neuter as easily. What other impacts do you think the pandemic has had, not just on our clinic, but on veterinary medicine?
So yeah, I can definitely. So during the pandemic, just to give a little background, that's when I owned my own clinic and I worked in private practice, and I saw firsthand how it affected a lot of veterinarians. The demand increased, but our time slots did not increase. You know, we couldn't work more hours. We were already working so many hours, and so people became a lot more demanding our services. And part of it was too is that a lot of people, they started working from home, so they started seeing little issues that come up with their animal that they would never have seen before. So then all of a sudden, it became a lot more frequent for people to come in to see us, and we had a very hard time with that. And so a lot of veterinarians did go through burnout, not just in the shelter medicine, but in private practice, in whether it be corporate or private. It was really overwhelming for both veterinarians and veterinary staff. Very much so. And also too, a lot of the time too, we couldn't actually go see our clients. They would have to sit in their car, and then we would either be on the phone calling them, and so we lost that personal touch a bit. There's a lot to be said for talking to someone, you know, face to face. Very much so. You can create a connection, and a lot of us really lost that, and that was also very difficult in the veterinary field. And a lot of us commented about how we're losing that the relationships that we have with everybody, and that was actually really difficult. So that was a big problem.
So looking forward, what changes or plans or improvements are you all currently working on for the clinic or thinking of working on?
One of the big things that we have tried to address is the overloading our veterinarians, taking care of intensive management cases from the public, taking care of all the shelter pets, everybody in foster care, really takes a toll on them to where they have hundreds and hundreds of patients that they're worried about and thinking about all the time. And so one of the things that we have decided to do moving forward is to change to a preventative medicine model. So we can get people spay-neuter services, heartworm tests, vaccinations, and exams, and let other clinics in the community take care of some of the longer-term issues so that we can increase our volume and our impact in the community.
I think piggyback on that, what Samantha stated also is efficiency, in ensuring that we are bringing pets in as quickly as possible so that they're not enduring an unwanted litter, and utilizing technology more for that. So utilizing an online calendar system where clients can go directly to the online portal and schedule themselves, rather than playing phone tag with us or getting in the queue of hundreds of messages on our voicemail boxes, which isn't very efficient. And so that we're able, again, to increase that volume that we do every day in the clinic.
And what they said was absolutely perfect. And the only thing I'll add to it is that we're also going back to doing vaccine clinics quarterly. And we're actually doing our next vaccine clinic at the clinic itself. We allow people to come and remember where we are, remember who we are, and give the opportunity to maybe if there's another career they want to add to their family. But that's also something that we're really looking forward to doing. We had great success with our last vaccine clinic. It was wonderful. We had a great turnout. The people were amazing. Everybody it was really a great thing. It really was.
Are there any other, I guess, overall trends in veterinary medicine, either positive or negative, that you are seeing out there, and how does that impact, I guess, what we're doing here on our campus?
One of the things that we're seeing are under socialized pets, especially since people were a little bit more quarantined, a little bit less involved with their communities. Their pets were also not used to seeing other people and coming into the vet hospital and things like that. So we're using a lot of fear-free techniques, a lot of low-stress handling, and trying to meet the pet where they are. So that's been a little bit of a challenge for sure.
Could you maybe describe what the fear-free program is, or system is, or what that is?
Sure,
I don't know.
So the fear-free program kind of works based off of the physiology and psychology of pets. And so taking into account things like the smells in the veterinary hospital, having treats available, your own body language and the volume that you speak and the tone that you use, all these things can increase or decrease a pet's fear. And so training our staff and going through fear-free training is really, really helpful so that these pets don't feel quite so petrified when they come to the vet.
Another, I think, positive for our veterinarian and veterinary support staff is finally they are getting more of a competitive wage compared to 4 years ago, 5 years ago, even 3 years ago, and so that is something on our end from a fundraising side and from a budgeting side that we do have to take that into consideration. We as an organization want to be competitive and make sure that we are bringing in talented, trainable, resilient staff into our veterinary clinic and make sure that we are offering the wages that they deserve. And so that is trending right now. And I think that previously that was not overall in veterinary medicine something, there was a lot of discussion about it, but now we're finally seeing that happening, which is great because they work very hard. It's a very demanding. It can take a toll on their mental health with the balancing of the caseloads and things like that.
And then another thing that's been more upcoming in veterinary medicine, and it's a very good thing, is actually more of a work-life balance. That's a very new concept in veterinary medicine. It used to be we would just work, and we were just working with no outside life, and people would quickly burn out. Veterinarians, technicians, after a couple of years, they'd be leaving the field because they just couldn't do it anymore. But now there really much is the push for work-life balance, which allows them, which I love that Animal Humane, we very much strive for that for everybody, is having a work-life balance. Because when they have that balance, they do so much better in the clinic. They are productive. We are productive. We're happy to be there, and we come with fresh faces and fresh attitudes, and we just work so much better together that way. And that's actually a new concept. That's actually it's a very wonderful change to see in veterinary medicine. Yeah.
Is there a difference between shelter veterinary medicine and I guess what you would call for-profit or general practice veterinary medicine? And if so, what are the differences, do you think?
From a technician standpoint, the big difference is sort of the mission or the driving force behind what you're doing. Everybody who gets into veterinary medicine loves pets, of course, but the mission that we have here and the impact we get to make is really so important.
From more of an organization standpoint, obviously the mission is very important, but we have animal sheltering guidelines that we have to follow that talks about how much care each animal should receive, treatment protocols that we can initiate, whether a veterinarian is here on site or not, because we're looking at the overall herd health and population management of the organization versus general practice where a veterinarian is truly looking at the overall care of one individual pet. So when we look at shelter medicine, we're looking at the overall population, and while diagnostics and other tests are being done or treatment protocols are being done for individual pets, we really take the overall population into consideration. And then we also use some of these guidelines to determine outcomes for our pets, whether that's adoptability outcomes or euthanasia outcomes. So very different compared to general practice.
Yeah, so from the veterinary perspective, there's definitely a big difference in that we're able to treat the animals as what we think they need. Versus in private practice, we have to get the permission from the owner, and there are a lot of times when we couldn't do it. But also too, in private practice and for-profit, they're also looking at what's the revenue? What can we do to get more revenue? And that was also a big thing too, very much so, where we can actually take the time and provide the animals with what they need versus what can possibly be provided, very much so. So it's actually, it's a nice difference. We have a lot more, creativity to be able to find treatments that are needed and to do what's needed for the animal themselves and for the population as a whole.
I assume another difference is the role of volunteers. And we have a number of clinic volunteers here. Maybe you can talk a bit about what are the different roles the volunteers play, what they do, and your need for volunteers, please.
Jim Gooden, come on.
Right there. This is
You
your
can get
moment
out of
to
your
shine.
chair.
So that's actually something that we talk about when we're recruiting, is the importance of our volunteers. We have recovery volunteers who recover pets from anesthesia, which is no joke. That's actually like the most critical time during anesthesia is during recovery. And to be able to trust a team like that is just so wonderful and rewarding that you don't see that anywhere else. And that really is something that brings us back every single day.
And then we also have volunteers that are washing our surgical instruments. And if you've never been in the clinic before, there's 20 to 40 surgeries going on every morning, which is 20 to 40 plus packs of instruments, which each have 10 plus instruments, and they all have to be individually cleaned and repackaged and sterilized, and that really helps create more time for our veterinary technicians and assistants to work directly with the pets throughout the morning and the afternoon. So being able to have the ability to utilize our volunteers in that capacity really benefits overall the care that we can provide.
The volunteers in the clinic really do so much. They do everything from recovery to the packs to doing laundry, cleaning kennels. It's just, we couldn't do it without them, very much so. They are just, I'm always in awe with all of our volunteers and what they do for us and what they do for the animals. It's honestly very inspiring. It's actually one of the reasons I joined Animal Humane was I was so inspired by the fact that we have so many volunteers that are so devoted and do such an amazing job. And they come every day with great attitudes, smiles, joking around. It's wonderful. I love it.
And going back to the private or general practice, you will see interns that may show up in a veterinary technician capacity or a veterinarian capacity in general practice, but typically there are not true volunteers. You may have high school students that are observing so that potentially they can become a kennel assistant or whatnot in the future, but you don't have actual volunteers, so very different.
Maybe you could say a little bit more about our, I guess, kind of new focus on preventative care for the owned pets and what that includes and what that looks like, and what are the goals of making that change from previously we were full service and now we're focusing on preventative care for low-income owned. So maybe you could say a little bit more about that.
One of the big changes that kind of goes along with this is moving away from the words low income to needs-based. And so making sure that we are being inclusive and not exclusive with those kind of services is a big deal for us. Kind of following the HSUS model and making it more accessible for more people. We want to really, really focus on spay-neuter because that is where we see the biggest impact in decreasing the amount of homeless pets. But we also want to make sure that they have their vaccinations, that they have their heartworm prevention and those kind of things as well. Annual exams can be very, very difficult to get into a clinic for, and so we want to make sure that we're a resource for owned pets as well.
And going back to the unwanted litters of puppies and kittens that we continue to see across the state, is if we can increase our impact with spay and neuter and preventative services, we hope over time we'll get back to pre-COVID numbers of puppies and kittens. Previously we did TNR, we were doing about 1,300 cats every year. When the pandemic started, we had to fully halt all spay-neuter services across the entire state. And I think that took us back about 10 years as far as the overall pet population in our state. And so we know that private practice and general practice are still struggling to keep up with the demand there. So if we can streamline our services for spay-neuter, hopefully we can have a broader impact across the state.
Absolutely. And the idea is too, is preventive care lays a foundation for the animals. It's a great start, very much so. And the idea too was not for us to be a jack of all trades, right? To go back to what we're really good at. Spay and neuter is one of them, and it's so important for our community, for the state. It's like Val was saying, the pandemic just set us back by easily a decade. Veterinary clinics in town are, they're booked out 3 to 4 months on a simple spay and neuter, or on even exams, even just preventative care exams, and that's a big deal, especially when that's where we start seeing outbreaks of disease because they can't get their vaccines for 3 or 4 months, and now we're behind, or the puppies can't get in. So really, forming a foundation can really help in the long run, help prevent disease, help them stay healthy longer, live longer lives. Spaying and neutering early, prevent those unwanted litters from coming in and having to be and overwhelming the veterinary system. It's a really great way for us to go. It really is.
Thank you. Well, I'd like it to open it up to questions, if folks have questions, and have we had any come online? Yes.
Samantha just mentioned needs-based versus income-based. Can you explain that?
Did everyone hear the question? Yes.
So we used to require that people bring proof of income, and we would use the WIC guidelines set down by the government. And that can be preclusive to some people who maybe don't have proof of income or access to that. Maybe they're living with their parents, so they don't have money, but their parents do. And we would ask for everyone in the household. So a person maybe couldn't afford services, but it looked like they could. And so we were really trying to move away from low income qualifying to something that is more needs-based. We kind of have the idea that we would love to spay and neuter your pet. We don't really mind if you make too much money. Your pet still needs care and still needs medical attention.
So how are you determining need, I guess, if you're going to needs-based?
We are taking a verbal instead so that it's a little bit less restricting. And we can still use the same guidelines, but if you say that you need it, we're taking you at your word.
So the trend right now in sheltering and providing some of this preventative care is trying to remove barriers for individuals. And so if we move away from low income to more of a needs-based, it makes it not just inclusive, but as far as from the staff perspective, it's the word I'm looking for, it had just escaped my mind. It's not as interrogating, and you are having to share private information that you likely wouldn't share with, you're already going through a lot of, many of these individuals are having to go through the state to get other human social service care for their families. And when we ask for them to show us their income, now we're creating another barrier where they may not actually come back and get the care that their pet needs. And so we can remove some of those barriers and make it more inviting, and that we're not here to judge you because we know that you likely are already going through other ways to get support for your family. How can we remove that barrier so that we know your pet is going to get sterilized? We know that you are trying not to contribute to the over pet population in our state. And again, that's a national trend that's going on right now, similar to removing barriers for adoptions and foster caregivers and things like that.
Yes, Terry?
So how are you getting the word out there for people who are in need?
Good question.
So historically, we have never marketed our clinic because the need has always been there, and the volume of care that is needed in our community has always outweighed what we can provide. And so we still have our website active. Samantha is part of our veterinary manager group, so she shares updates with them that we have reopened our donor-subsidized veterinary clinic, and we're providing the veterinary services. So we're hoping that just by word of mouth, as previous years, we won't have to market because we know that the need is there. But as people are calling, that barrier is a little less and a little more removed rather than, please send us this proof and let's talk through this. And do you have W-2s or pay stubs, whatever that may look like.
Tony?
So I'm thinking of the pet food bank, and one of the things that we require is a proof of income.
Yep,
So-
we actually just talked about this with Vince recently,
Okay.
about potentially, right now, some of you may not know this, but the pet food pantry has been very in need. And we have not had as many donations come through from either locally or from like our Walmarts, places like that. And so we recently had a discussion with Vince of, this is what we're doing in the clinic. Are we ready to potentially change that in the pet food pantry? I don't think we're there yet, but that is something where if we're looking towards moving towards a community access and community resource programs within our organization, potentially removing some barriers in the pet food pantry as well.
Nancy?
I hate to say this, but there are always abuses of the system.
There are.
And so how do you prevent those who are very capable of paying for services taking advantage?
Well, we do charge for our services, so they're not getting anything for free necessarily. But it also, in the long run, helps everybody out if we can take care of that pet. So if there are less litters happening, that's gonna help us anyway. So we look at it as a community-based program, really, instead of just an individual family.
And I think, we are still vetting the clients as they come through. So they sign up online and then our receptionists reach out to say, this is what the program is. We're confirming your appointment and ensuring that they know that they have to pay the fees. This isn't a free program such as the city or the county programs. And again, looking at it more of a community-based resource. If we can prevent more pets from coming into the shelter, we're not the police, and we're and trying to be the police and trying to judge people based off of the vehicles that they're coming in with, things like that. That puts even more of a strain on the staff themselves. So if we can really level out the playing field and really put the message out there that this is for needs-based, and maybe you're in need now, but in 6 months you may not be in need. So trying to change the message, it's going to be a work in progress, but we want to be as inclusive as possible.
And just adding to it, and it's you guys said it so eloquently too, very much so. But also too, the cost of spays and neuters have actually exponentially gone up. The average cost in Albuquerque alone is about $600 for a spay, up to $1,000, and that prices a lot of people out. And for such a procedure that really is so needed in the state. It not only prevents those unwanted litters, but it also prevents disease. It prevents mammary cancer. It prevents other diseases. It prevents animals from roaming. Very much so. Dogs, the male dogs, they can smell a female in heat 2 miles away. He's gonna go looking, and that's what we don't want him to do. And so, if we can find ways to provide access to these services that are so needed, it's really a great thing for the community as a whole.
So when people come for, like, when you're gonna have your spay and neuter clinic, the vaccination clinic, okay, so they come in and obviously the dog's intact. Okay, so do you encourage, so I'm sure you're gonna encourage them, and you can bring your dog in, give them a voucher or something, but yeah, please, will you do the vaccination clinic if the dog's intact?
Yes, so what we're referring to is the pet health fairs. And so those are targeted to specific zip codes that need help, and sent out invitations to those people. So we absolutely recommend coming in for spay-neuter services. Some of these people, that's the only time that they ever get to see a veterinarian and talk to them. And so even just having the advice from Dr. Robertson, makes a difference in that decision to spay and neuter.
Before the pandemic, when I used to answer phones at the front desk here, I remember that the city said they would do spay and neuters for low to moderate income. And their table said what moderate income was, but it clearly said you didn't have to prove it. And I used to tell people that maybe they couldn't come here, but if they were citizens of Albuquerque, if they met the moderate income, which was looser. And so it struck me at that time that if you just said to people, it's a point of, we're taking your word for it, and it's low to moderate, and so you're not stigmatizing them in any way, and you're not making them prove, because the city didn't make them prove. So it's just a very interesting thing, and so I was putting that all through my head as you were talking about this, that if people understand that's what they're agreeing to, that might be easier. And I guess people will take advantage, but to not have a program, because those who take advantage will figure out a way anyway. They'll do something, so, yeah.
One of the things that, because our staff does question that, we want to make sure we're helping whoever needs it the very most, right? That's what we all are here for. But if you are judging somebody, you have to choose between judging them and helping them sometimes. And I'd rather us help them.
Any other questions? Yes, Nancy?
Back in the old days, when we were doing so much spay and neuter, one of the negatives for our veterinarians was so much spay and neuter. And so we started to diversify and do orthopedics, and dentals, and all that type of thing. And it helped to improve veterinary morale. So how is that going to play with the preventive care?
So we still do dentals, and I'm actually doing, we'll still do some orthopedics, not extensive like we used to, not like we were doing pretty extensive, but we'll do things like fracture repairs, that kind of things. It does break it up for the shelter animals. And a lot of animals, they do need dental care. That's very important. And Dr. Blossom absolutely loves dentistry. Every time she's there, she's just like, that's mine. She does. She calls dibs before I can even get to it. I'm like, okay, sure, why not? So no, you're right. It does help with veterinary morale to have some variety. So we do still have the opportunity to do it with our shelter animals, which is great. And we do, and they're still so much in need. They come in commonly with fractured teeth, or fractured legs, or other dental disease going on. So we do have really a lot of opportunity to still help diversify ourselves and keep our skills up, honestly. Is really what it comes down. Or mass removals. Oh my goodness, yes. Yes, we do. We have a lot of them that come into the shelter with masses that need to be taken off. Absolutely. We still absolutely do all of that.
Piggyback on that, the great thing is that because our veterinarians still want that, to be able to do those specialty surgeries, we can actually work with our transfer partners who may not have a veterinarian on staff. So we can transfer those particular types of cases into our care, so that we're not only, again, helping the pet, but we're also playing into the specialties that they enjoy doing. So that balance, again, is what we're going for. We don't want to overwhelm them with everything in the shelter, as well as 10 orthopedics out in the community, and then all the TNR. Something we didn't touch upon, but that was in my notes to talk about, is that a difference between our clinic versus a general practice is that we really operate 3 different veterinary practices under one roof with one team 4 days a week. And that's our shelter program, so all of the veterinary care for our shelter pets. That's our TNR program, and then that's our preventative service and program to the community. If you look at other organizations, even Santa Fe Humane, they have those 3 programs, but they have 3 different buildings, multiple different veterinarians, all working separately. So that is very unique to our organization. If you look at some of the larger programs in the nation, such as San Diego Humane or Oregon Humane, they also have multiple satellite programs at different locations. And so that is also something we need to balance, is that we can't overwhelm our veterinarians by doing everything for the public as well as all of our shelter cases, because we never know what's going to come in through the shelter. Even though we have a transfer of 10 healthy pets, guaranteed someone's going to need a dental, a mass removal, and maybe an orthopedic repair. Or something happens while the pet's in our care and, oopsies, it was, in a play group and now we have an injury that we need to tend to. And so making sure that we can balance all of those 3 different programs to ensure that they're getting their work-life balance, the pets in our care are getting the adequate vital treatment that they need, and we're still servicing our community.
We had a question over here.
I just wanted to ask about your TNR. Are you just doing it when people bring in cats, or are you actually managing community cats colonies?
People from the community bring us cats.
Okay.
Yeah.
So in previous years, we have worked with Street Cat Hub, and they used to bring us cats twice a week. They now have a full-time veterinarian, so they've been able to increase their capacity with surgeries, and they are the ones that are going out and working with the specific colonies. And so that's another program. Since we have never operated TNR with just the community, because we don't have, we still partner with Street Cat Hub, but we don't have that continued influx of TNR cats. We're working on ways to revamp and figure out how we can make that impact in the community. So either that's by word of mouth, social media. We recently had a post about TNR. The community members can rent traps directly from us, but it does take the extra work, and it's hard to trap cats on your own if you're not experienced. So.
Thank you.
We have a question, Tony?
All these outlying shelters and clinics that you take pets from, do they all have a veterinarian that works there and staffs there? And if not, does that present, talk a little bit about the problems that come up there?
Yeah, that's a great question. So I would say it's about 60-40, so about 60% either have one full-time veterinarian on staff, or they contract with a veterinarian in their local community who may come 1 or 2 days a week to the shelter. And typically all they're doing is treating the pets that may need care right then and there. So the problem that poses is that we, again, get pets through transfers that may not have been fully vetted. So they may come to us with parasites. They may arrive with URIs that weren't upper respiratory infections that have gone untreated. Lameness, parvo, fractured teeth, things like that that have been untreated because they just don't have the resources, or the contracted veterinarian only provides very general treatment to the shelter pets.
Yeah, so it does create a little bit of complication, very much so, where we have to make sure that we want to make sure we vet them and make sure that they're taken care of. Because there are some shelters where, unfortunately, they don't have a veterinarian and they're having to adopt animals out who are not spayed and neutered. And they have a contract, they put it in the contract that they will get them spaded, but that's not a guarantee, right? So it does create a little bit, it does make it more difficult, and it just goes along with having the veterinary shortage. We just do not have the staff available to provide for as many shelters that we have in the state. Not just the state, but nationwide. It can become difficult.
Something that some of the larger municipal shelters are trying to coordinate are their pop-up spay-neuter days, where they're actually working and paying a very large amount of money to bring in organizations that they just do pop-up spay-neuter clinics. So they will actually bring in veterinarians into our state, host an all-day event, and do 100 spays and neuters for a hefty price tag. The other problem that we face within New Mexico is that there is not a temporary license for veterinarians to come in and do a one-day workshop or a one-day pop-up spay-neuter. They have to go through the full licensing requirements through the Board of Veterinary Medicine. So again, that's just another barrier that we're having to work through. If we're really looking at spay neuter, how are we going to be the most impactful? And that's again another reason why we're really opening just to the preventative services here in our clinic. Yeah, Tony?
Is there a program in the country for the equivalent of physician assistant, veterinary assistants, like extenders for veterinarians?
So in the middle of the pandemic, there was, do you remember what school it was through? Michigan?
Michigan.
Yeah. Michigan started a pilot program for a middle tier. So you had to be a licensed registered veterinary technician, and then you could go to an 18-month program to be this middle tier PA. The problem is that it would really only work within shelters because you could only provide veterinary care at a certain level, like lacerations, you could prescribe certain medications, but you could only provide care to pets that you had ownership of. So you could not provide pet care to public pets. So it would work for our shelter environment because we do own our shelter pets, but I have not heard, there was like one email that went out and I think it was a dead end. You can speak more on the veterinarian side.
Yeah, no, so it is, and that's actually been a really hot topic, honestly, in the last couple of years in veterinary medicine, is the topic of having some type of middle-level practitioner. And people on both sides have a lot of feelings about it. So unfortunately, right now, we're kind of at a standstill, because part of the thing, too, is that the idea is to utilize the technicians we do have, the skill set that they already do have, and they can do so many things. The problem also comes at the state level. Every state is different that allows what technicians can do. And New Mexico is very restrictive as far as the level as what they're allowed to do. Where other states are a little more lenient, they can allow, very much so. Going and getting your RBT, they learn suturing techniques. They learn how to do that. Not in New Mexico, but new. So that's part of it too, is working at the state level to empower our technicians to do more of what they're capable of doing. They're so capable, but also too looking at the idea of having that mid-level practitioner. Right now, it's unfortunately hit a standstill at the national level.
Do you want to just discuss about the RVT program, just so they have an idea of the size of it?
So to become an RVT, it's usually a 2 to 4 year program depending on your school, and it's pretty intensive. With human medicine, you can kind of specialize in a certain area, but in veterinary medicine, you have to learn all the things. So you're not only doing handling and restraint, but vaccination, blood draws. You're in charge of anesthesia. You're in charge of radiology, lab work. You're pretty generalized, and so it can be a little preclusive to some people as far as studies go, because you're also learning about anatomy and physiology and pharmacology and all of these things. And you get a really, really great education, but then maybe the state doesn't allow you to practice certain parts of your scope. And if you don't practice it, then you definitely lose it.
What does the R stand for?
Registered veterinary technician. And that also changes very based off of which state you're in. You may be an LVT or a CVT or an RVT.
So licensed, certified, registered.
Yeah.
And are they different levels of skill?
They are the same thing,
Oh,
unfortunately.
Yeah, they're the same.
Yeah.
In New Mexico, well, I guess we have 2 right now. We used to only have CNM as an RVT program. Recently, PIMA, just this year, is their first cohort of RVT students. We used to have Brown Mackey, but they have since closed right before the pandemic. So that also prevents, a very small class size, and there's 2 classes a year. So twice a year we get graduates out of the programs, but because we have so many veterinary practices, it's, if you can snag one, it's like 1 in a million. So that's another reason why it's really great that if we can get these students into our clinic at the get-go, then we have a greater chance of retaining them as employees.
Are there areas where the volunteers can help you more than they already are?
Do you see other areas where you could help us more?
Actually, yeah. We will do anything.
Do you want to share an idea that you have, and maybe that will spark something for us? I can't think of anything.
I can't think of anything specific right now, but really, we're there to help, and sometimes we're just kind of standing there twiddling our thumbs.
Cheryl's going to say.
Cheryl, she's right, they do everything. I mean, one day they didn't have anything to do, and the partner that she has, they reorganized all the food for me and made it look perfect. We have great volunteers, they do awesome.
Well, we have a great team too. I'd like to relay a little incident that I had part in. I was recovering a cat, and she quit breathing, and I started back to the front with the cat, and one of the techs grabbed her. There were 2 vets there and 5 other techs there, and they pounced on that cat. I mean, it was just like a ballet. Everybody knew what they needed to do. They did it without being told, and they brought her back. And I was just in awe,
Yes, our techs and our veterinarians are also emergency doctors, and they need to be.
Yes. Yeah. I mean, there was no mixing of roles. There was no arguing. Everybody did everything that needed to be done.
Yeah, Samantha's big on the codes.
And that's actually something that we purpose to do. So we run mock codes together. We talk through who's going to be doing what. There are specific roles for a code. So there's a doctor present. There's somebody securing the airway. There's somebody getting a catheter in. There's someone drawing up drugs, and there's somebody taking notes. And so everybody really does have a role, and it's wonderful to see when that happens. Because you could easily panic and not help that pet, but everybody knows what they're supposed to do, and it's just beautiful.
But I would encourage you to use your volunteers more.
No, I think that's actually a great question. It's to be continued. What, Jim? What, Jim?
You're gonna crack the whip harder on me?
So what does happen Friday, Saturday, Sunday?
Good question.
So we're closed, the vet clinic is closed. The question is, what happens when we're closed?
So we do have a technician who works Tuesday through Friday, and so we do have a technician in the clinic Friday, and then animal care will help us with any pets who are housed in the clinic. I am on call for any questions or concerns. We have lots of good protocols in place, and Dr. Robertson is also very gracious of helping us with that as well.
Any other questions? Well, thank you. I think this has been a very interesting, inspiring discussion. Thank you all so much, and thank you for coming today, and thank you all for supporting the work of the clinic. As you all know, it's pretty incredible and so important. And is anyone here interested in a tour of the clinic?
Sure.
Wonderful. You could get a tour. Some of you could get tours. So Samantha's our tour guide. Oh, and Dr. Robertson. Good. So do you want folks to meet you, I guess, over at the door? And thank you all so much again.
Thank you.